ready to begin.
Okay. Would you do the roll call, please, Denisha?
Yes, Chairman. I'll begin with Norman Boyd.
Here.
Roger Folsom.
Here.
Russ Childers. Russ Childers.
Here.
Thank you. Russell Crutchfield.
Present.
David Cruz.
Here.
Anthony Williamson.
Here.
Nelva Lee.
Here.
Cynthia Rucker.
Here.
Kenneth Davis.
Here.
Chairman, that concludes my roll call.
Thank you, Denisha. And that is 100% attendance today, and we appreciate that very much. So therefore, we have a quorum to conduct business. I'd like to welcome all of you to our meeting this morning and express our thanks for your adjusting your schedules for an early start time today. Our agenda today is a pretty full agenda. We have for the board, we have one item that we will consider for vote on final adoption, and 4 items will be asked to vote on for initial adoption. With that, I'll start the meeting today by calling on our secretary, Russell Crutchfield, to see if he has had a chance to read the minutes from our December 9 and December 14 meetings, and if he would recommend approval as written.
Well, good morning, Mr. Chairman. I have reviewed the board meeting minutes from the December 9th and December 14th board meetings, and I have found them to be correct and in order. And I move that we approve the board meeting minutes from these 2 days, December 9th and December 14th.
Motion has been made to approve the minutes. Is there a second?
Folsom, second, Mr. Chairman.
Mr. Folsom has seconded that motion. All in favor say aye.
Aye. Aye.
Opposed? Abstaining? Hearing none, they are approved. Thank you, Russell. With that, I will move on and turn the meeting over to Commissioner Nagel for the commissioner report.
Good morning. Thank you, Mr. Chairman, and thank you, board members. Hope you all are enjoying a very happy new year thus far. We're excited to get back into the normal course of business and things underway as session gets started. On that front, we do not have agency legislation this year. Our main priority will be supporting the governor's budget recommendations and supporting others, an agency that comes about that may impact DCH. But we do expect our budget, it'll be out later this afternoon, but we're expecting it to be pretty positive. And so be happy to share details of that when it comes out. And we have a joint budget hearing next week where we'll review that with members of the joint House and Senate Appropriations Committees. A couple of staffing things to share with you. I don't know that I did it at our last board meeting, but I did want to formally welcome Chad Purcell to the agency as our new Chief Technology Officer. Many of you likely remember that Joe Hood previously served as our Chief Compliance and Technology Officer. Joe at one point thought he was going to retire. I know I shared with you that he's going to stay on, but we've split that role into 2, a Chief Compliance Officer and a Chief Technology Officer. So we're glad that Chad has joined us. We have a new communications director joining us next week, David Graves, and we're very excited for him to be joining us from the private sector. Should do a lot of great things in the communications department for us. Lisa Walker, our CFO, has accepted a position with another state agency and will be leaving us, I think, in the next week or so. And we're currently recruiting for a new comptroller. Joe Hood is filling in kind of that finance role for the time being as we kind of sort through what next steps look like in that role. I know that we all kind of wish for the days of way back and pre-COVID. I know that my own family has fought with COVID lately, but the Omicron variant has continued to put a lot of pressure on our healthcare system. And to that end, Governor Kemp, I know you probably heard recently announced both deployment of National Guard, but also authorized DCH to re-engage our staffing augmentation around the state. And so we are in the process of recruiting up to $100 million of new and extended staffing augmentation nurses and other frontline clinicians around the state to support our hospitals during this round of COVID. On that front, as part of that, we will work to supply about 130 or 140 staff to the psychiatric residential treatment facilities, or PRTFs, in the state, so that they can bring back online some additional beds that will that play in a really important role in that continuum of care for both DFACs and others our most vulnerable youth. And so we're hopeful that we can recruit for those, at least on a temporary basis, and help keep some of those beds online. As I've mentioned, PRTFs, one item that you'll note is on the agenda today for initial adoption is a rate increase, a 5% rate increase, and then an additional rate increase when there's a co-occurring diagnosis of autism. I think this is a really good positive move in terms of our PRTFs and being able to preserve bed capacity in the state for Georgia's children. I know I've done it before, but I just want to take a moment and thank everyone on the PRTF work group, Dr. Erica Sitkoff with Georgia Voices, Cheryl Dresser, the staff at DBHDD, all the PRTF staff and the staff at DCH. This is really good and positive work that we should be really proud of. It's a first step in this regard, and I'm hopeful that we'll continue to work on that, but very thankful that we're able to bring that to you today. The ground ambulance upper payment limit program was approved by the board in 2020, and just within the last week or so, CMS has approved our funding methodology for that. We expect payments for that program to begin going out the door in late February, so our providers can look forward to that. Good news on our MEST project, the Medicaid Enterprise System Transformation, reached another milestone. CMS has approved our contract with our provider services module, so our teams will kick off that implementation probably later this month. And likewise, our Office of Analytics and Program Improvement, led by Daphne Kite on our team, completed their phase 3 pilot of the EASE portion of that project, which is bringing all of our data warehouse architecture and infrastructure internal and being less reliant on some external vendors. They'll now move on to full implementation of that, and that's a pretty significant project for us. We're starting work on a new project, a new state-directed payment program, which would ultimately, if approved, increase managed care reimbursement rates at our hospitals around the state. It'll take a series of moves, but it will ultimately, if approved and implemented, result in a significant decrease in uncompensated care costs around the state. We've had some really positive early conversations with both our partners and providers and with legislators. It does require a little bit of budget support, so it's still tentative at this point. But as that progresses, we'll keep you posted. And if there is continued support, we'll certainly be back in front of the board with more details and certainly action items in the coming months. I know many of you probably read and saw that DCH received a new letter from CMS regarding our Pathways project. We're certainly disappointed by that letter. We were very excited about the state's innovative approach to that project, but we're looking at all of our options and what's left. Whatever our next directions are, we'll come back with you in the coming weeks and share that with you. And then, as I always like to do, I want to take a moment and acknowledge some employee milestones within the agency. Again, staffing around the state in all sectors continues to be a challenge. So we're thankful to our state employees: Jacinta Carmichael, Keona Crawford, Joanne Eccles, Tara Edwards, Clarissa Felix, Indra Krishnan, Kanisha Johnson, Lillian Peoples, Barbara Rivers, and Emily Salinas are celebrating 5 years with the department, and Elaine Adams and Jeannie Ware are celebrating 10-year anniversaries with the department and the state. So thank you to them for their service. Happy to answer any questions, Mr. Chairman, but thank you.
Thank you, Commissioner. Are there questions or comments from the board, please? Hearing none, we'll move into our first agenda item that we will consider for final adoption. And Lynette Rhodes will make the presentation related to medical assistance plans and the state plan amendment.
Thank you.
Please
Good morning,
proceed.
Chairman Boyd. Good morning, Commissioner and members of the board. Pending approval from the Centers for Medicare and Medicaid Services, the Department of Community Health proposes to modify its state plan to allow for coverage of routine patient costs associated with participation in qualifying clinical trials for Medicaid members. During the special call board meeting held on December the 14th, 2021, I informed the board that the Centers for Medicare and Medicaid Services issued guidance to state Medicaid agencies regarding mandatory coverage of items and services associated with qualifying clinical trials. Specifically, the guidance directed state Medicaid agencies to cover any item or service provided to a Medicaid member who's participating in a qualifying clinical trial to the extent that the provision of such items or services would otherwise be covered outside of the course of participation in the qualifying clinical trial under the state plan. Additionally, the guidance from CMS outlined the items and services that should not be covered by state Medicaid agencies. This includes any investigational item or service that is the subject of the qualifying clinical trial and is not otherwise covered outside of the state plan. Additionally, routine patient costs do not include any item or service provided to the member solely to satisfy data collection and analysis for the qualifying clinical trial. An opportunity for public comment was held on December the 20th of 2021. Written comments were due on or before December the 27th of 2021. We did not receive any oral comments. However, we did receive written comments from the following entities and individuals. Lynn M. Durham, the president and CEO of the Georgia Center for Oncology Research and Education, also known as CORE, the American Cancer Society Cancer Action Network, the American Urological Association, ANCAN, Cancer and Careers, Male Care Cancer Support, Patient Empowerment Network, the Prostate Cancer International, Prostate Cancer Research Institute, the Society of Women in Urology, the University of Illinois at Chicago, and finally, ZERO, the End of Prostate Cancer. In summary, the commenters were in full support of the proposed change, as it will improve access in underserved communities, eliminate barriers, and help to eliminate health disparities. Additionally, the commenters noted the importance of having a diverse population of participants in clinical trials, as it informs how various medications and treatment impact people of different races, ethnicities, and genders. In response, the department thanks the commenters for their written comments and for their full support. Thank you, Chairman.
Thank you. And then, as you mentioned, it's nice to see all the supportive organizations that took the time to provide that kind of input, and it's good to see that kind of support. So with that, I'll ask the board if anyone has any questions or comments. If hearing no comments or questions, is there a motion for approval for final adoption?
Mr. Crutchfield, Russell Crutchfield, move to pass.
Russell Crutchfield has made the motion for final adoption. Is there a second?
Nelva Lee seconds.
Nelva Lee has seconded that motion. All in favor say aye.
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 Opposed? Abstaining? Hearing none except a vote of confidence, it is approved. Thank you very much.
Thank you,
Lynette, for your presentation and for your work on this important subject. Next, we'll move into another area of medical assistance plans for a state plan amendment, and Brian Dowd, Deputy Executive Director of Medical Assistance Plans, will make a presentation.
Thank you, Mr. Chairman, Commissioner, members of the board. Today I'm presenting for initial adoption a proposed rate adjustment for psychiatric residential treatment facilities. As the Commissioner mentioned, over the last year, we've really been looking at this system of care for children across child-serving agencies and with providers and members. The goal of that was really to look at increase access to quality services and reduce out-of-state services that we have to deliver. So there was a subgroup to that kind of system of care to look at what we think of as kind of our deepest end service for behavioral health, which is psychiatric residential treatment facilities. And that subgroup consisted of DCH, Department of Behavioral Health and Developmental Disabilities, Voices for Georgia's Children, with a lot of input from a ton of different places. We looked at a lot of data. We looked at Medicaid claims data. We looked at CMO related data. We looked at prior authorization data. We looked at self-reported data from the PRTFs themselves. We also looked extensively at the policy and procedures related to PRTF. During this work group, so our process through the work group, Executive Director Rhodes said, we need to go visit these 6 psychiatric residential treatment facilities. And I think I said, all 6? And she was like, yeah, all 6. So we went out, myself, Catherine Ivy, Lynette, various members for budget and finance, quality members from the Medicaid unit. We went out and visited all 6 of the psychiatric residential treatment facilities. The commissioner and Ryan Loke also met with the members of the psychiatric residential treatment facilities on site as well. We took away a lot of learnings and a lot of suggestions from the work group and from our site visits. A lot of policy things that are at the federal level that we can talk to CMS about the possibility of what there is that can and cannot be modified. Our own HRFD regulations, healthcare facility regulations, and then some Medicaid regulations. But one of the biggest learnings we had from those site visits and from the work is that we needed to really look at our rates. We are in competition for the bed space with private insurance. We are in competition for the bed space with out-of-state Medicaid agencies. We actually have children who are in our facilities who are out of state from other Medicaid agencies. So we went back and looked at what was available for us to do within the state plan. So this psychiatric residential rate adjustment initial adoption we are proposing today is in response to that. We are proposing a 1/14/22 implementation date pending CMS approval. There are 2 portions to the rate adjustment that you will see in the briefing, in the public notice. The first one is for children that are just behavioral health diagnosis related. The state match for those services goes to the Department of Behavioral Health and Developmental Disabilities. And we worked with the Department of Behavioral Health and Developmental Disabilities to do what was most advantageous to the providers, which is to utilize the 2019 cost reporting with a 5% inflation factor. Now, as you'll see from the public notice, that led to a significant increase for 4 of our PRTFs. 2 of our PRTFs did not receive a rate increase. And the reason they did not receive a rate increase is because their cost reporting actually showed a significant decline. So luckily, we do have within our state plan a provision to hold facilities harmless when they have a significant decline. So we will be holding their rates the same. And that's to prevent destabilization of the network. So that's the first portion of the rate increase. And you will see those rates in the public notice as they have increased or stayed the same. The second portion of the rate increase, part 2, is for children that have a co-occurring diagnosis of autism. We first introduced this rate back in 2019, April 2019. And we based it on what we looked at other states for providing the rate, which was $440. Since that time, now I do need to mention that the ASD portion has its own policy manual. So it has its own rules and regulations because serving children with autism is different than serving children with just behavioral health diagnoses. Whereas a normal section of the PRTF may want stimulus and a lot of bright colors in order to help with the treatment plan of the child. The ASD section wouldn't necessarily have those same things due to those children with their co-occurring conditions. So it's a separate policy manual. We did have one facility, Laurel Heights, that re-engineered one of their buildings within their campus to serve children with autism specifically. And we used their cost reporting from 2020 to adjust the cost report rate for children with a co-occurring diagnosis of autism. As you will see from the public notice, it is a significant increase. We think that's a very good thing. Hopefully that will encourage more of the PRTS to follow the policy manual or adopt the policy manual. It's not follow the policy manual, it's more adopt the policy manual and provide those additional services to children with a co-occurring diagnosis. They do provide services to co-occurring children now, but not in the methodology that is set in the policy manual. So the fiscal impact associated with this rate change for state fiscal year 2022, as you'll see in the public notice, is $78,795.58 for the part 1, which comes out of the DBHDD budget. And then for DCH, for the increase for the co-occurring children with autism, you have $147,094.44. And you can see the state fund impact for both agencies for the full year below at $176,512.56 for DBHDD for the full state fiscal year of 2023, and $329,511.05 for DCH for that part 2 for the full state fiscal year of 2023. One thing that I forgot to say, and I'm sorry that I'm circling back to it, previously in the part 1 rates, we had a cap on services. The most we would pay a PRTF was $407. We worked with DBHDD, which was great and very cooperative and responsive, and have agreed to remove that cap ongoing and base it on the actual cost reports. So an opportunity for public comment on the proposed changes will be held on January 19th, 2022 at 11:30 a.m. Written comments are due on or before January 26, 2022. If there are any questions, I would be happy to answer them at this time and will respectfully request the initial adoption of the rate adjustment for psychiatric residential treatment facilities. Thank you.
Thank you. Are there any questions, comments from the board, please? Well, it sounds like, Brian, your department's done a tremendous amount of background work in preparing this, and I thank you for that detailed presentation.
Thank you, Commissioner.
With that, is there a motion for approval for final or initial adoption, please?
This is Nelva Lee. I motion to approve for final adoption.
Nelva Lee has made the motion for final for initial adoption. Is there a second?
Ken Davis, second.
Dr. Davis has seconded that. All in favor say aye.
Aye. Aye.
Opposed? Abstaining? Hearing none, it is approved. Brian, thank you very much. Look forward to your public comments when they come back. Thank you.
Thank you, Mr. Chairman.
With that, I'd like to call on Rich Kim, Interim Budget Director, will talk with us about the nursing home general and professional liability insurance. Initial adoption will be considered for this as well.
All right, good morning, Mr. Chairman, Commissioner Noggle, and the members of the board. Today, I'm presenting for initial adoption a proposal to update the nursing home reimbursement rate to use the 2021 general and professional liability insurance cost. Currently, the nursing home reimbursement rates are based on 2019 cost report, inclusive of general and professional liability insurance, a property tax pass-through, a 5% growth allowance inflation factor, and a hold harmless provision for the first year. COVID-19 has substantially disrupted an already fragile senior care marketplace, further impacting the nursing home industry's general and professional liability cost. Insurers continue to cite the substantial increase in the frequency of high severity claims and their negative impact on loss ratio. These trends are driving insurers to adjust the structure, the coverage, and pricing of most towers of insurance. Therefore, using 2021 general and professional liability insurance will be the most reflective of capturing current trends in the senior care marketplace. Effective February 1st, 2022, The 21 general and professional liability costs will be used in the nursing home reimbursement rate calculations. The cost report will be updated at the minimum every 2 years. During the transition year, the department will apply a hold harmless provision to the nursing home reimbursement rates. The hold harmless provision will be in effect through June 30th, 2022. The total cost for this proposal for state fiscal year 22 is $599,208, of which federal funds are $400,571, and the state funds are $198,637. The total cost for 23 is $1,438,099, of which the federal funds are $961,369, and the state funds are $476,730. An opportunity for public comment will be held on January 19, 2022 at 10:30 a.m. via WebEx, and a written comment to the department is due by January 26, 2022. I'll pause there for any questions.
Any questions or comments from the board, please? Hearing none, is there a motion for approval for initial adoption?
Cynthia Rucker.
Cynthia Rucker has made the motion for approval for initial adoption. Is there a second?
Russ seconds.
Russ Childers has seconded that motion. All in favor say aye.
Aye.
Opposed? Abstaining? Hearing none, it is approved. Thank you very much.
Thank you, Mr. Chairman.
Next, we'll move to Stacy Hillick, Executive Director of the Office of Health Planning, talk about rules and regulations for health planning administration.
Good morning, Chairman Boyd, Commissioner Noggle, members of the board. The Office of Health Planning presents rules today for initial adoption. These rules are found in Chapter 111-2-1 of the Department's Rules and Regulations and are necessary in order to reflect legislative amendments to the State Health Planning and Development Act, to correct grammar, to provide clarity, and to modernize the rules. A draft copy has been provided to you. I will review the key changes as follows. The proposed changes make updates to the functions of the Office of Health Planning to include references to utilizing technical advisory committees to prepare and revise a state health plan, to seek advice from technical advisory committees as the department's discretion, to provide for a fee exemption for certificate of need application filing by a rural county hospital, to study, recommend requirements for, and track the amount of uncompensated, indigent, and charity care required by each type of healthcare facility. The proposed changes include empowering the commissioner to establish and abolish technical advisory committees in consultation with the board in order to inform effective strategy development and execution. A public comment hearing will be held on February 15, 2022, and written comments may be submitted on or before February 18, 2022. The department is requesting consideration of these rules for initial adoption today, and I'll be happy to answer any questions about the proposed changes.
Are there any questions or comments from the board, please? Hearing none, is there a motion for approval for initial adoption?
Roger Folsom, motion for approval, Mr. Chairman.
Mr. Folsom has made the motion for approval. Is there a second?
Second from David Cruz.
David Cruz has seconded that. All in favor say aye.
Aye.
Opposed? Abstaining? Hearing none, it is approved, and you may move on to your next item.
Thank you, Chairman. The Office of Health Planning presents for initial adoption revisions to the rules found in Chapter 111-2-2 of the Department's Rules and Regulations. The revisions are necessary in order to reflect legislative amendments to the State Health Planning and Development Act, to correct grammar, to provide clarity, and to modernize the rules. A draft copy has been provided to you. I will review the key changes as follows. The proposed changes make updates to the health planning regulations so as to revise provisions related to certificate of need requirements, to revise and provide for new definitions relative to health planning and development, to prohibit certain actions related to medical use rights, to revise provisions regarding when a certificate of need is required, to authorize destination cancer hospitals to be converted to general cancer hospitals, to revise and provide for additional exemptions to certificate of need requirements, to provide for requests and objections to letters of determination that an activity is exempt or excluded from certificate of need requirements, and to provide for annual reports to be made publicly available. Other changes are proposed to allow for electronic filing. A public hearing, comment hearing will be held on February 15, 2022, and written comments may be submitted on or before February 18, 2022. The department is requesting consideration of these rules for initial adoption today. I'm happy to answer any questions.
Are there any questions or comments from the board, please?
Chairman Boyd, this is Anthony Williamson. I do have one comment.
Yes, please.
It's my understanding that the electronic filing has worked, pretty well since that's been implemented during our pandemic time. There have been times when it has gone down, as happens through these sort of systems from time to time. And also, it's my understanding that not all types of filing are handled by the current platform. So just a comment that as we move to the more comprehensive e-filing, it would be helpful if that could include all types of filing for CON related activity, as well as having a backup system if there's going to be extended downtime.
Right. The department is aware that not all request types are currently available for online filing. It is something we're definitely working on as we try to provide multiple opportunities for facilities to file their requests electronically. Definitely providers have expressed considerable support for our online portal, and we'll continue to improve and expand on it.
Any other questions, comments from the board, please? Hearing none, is there a motion for approval for initial adoption?
This is Anthony Williamson. I would motion for approval.
Mr. Williams has made the motion for approval. Is there a second?
Russ, second.
Russ Childers has seconded that motion. All in favor say aye.
Aye. Aye.
Opposed? Abstaining? Hearing none, it is approved. Thank you very much for the presentation.
Thank you.
Thank you. With that, it concludes our agenda items for today. Is there any new business that anyone knows of that should come or before the board, or any comments anyone would like to make? Hearing none, I would again thank the department for assembling all of the advanced information so that our job today, we could review in advance the agenda items and the backup materials, and appreciate that work. Our next meeting will be on February the 10th, and we'll return to the 10:30 start time. With that, the meeting is adjourned. Thank you so much. Have a good day.
Thank you, Chairman.
Thank you.